begin. Bismillahirrahmanirrahim. Assalamu alaikum everyone. Well, my name is Usman. I'm from 2018 batch. So before I begin the presentation, first of all, I'd like to thank you, Sir Noman, for giving a chance to explore our skills. So let's begin to the presentation. Okay. So first of all, this PPT is made by Dr. Sehrish. This is our group members: Charlie, Sehrish, Hanzala, Ahmed, Rahil, Usman, 4. So we are group B. So let's begin. So first of all, these are table of contents. So general inspections. First of all, you need to see that. Vital signs, peripheral exam, upper limb, face and neck, chest and legs, abdominal exam, inspections, palpations, percussion, auscultation. Okay? So let's proceed this. General examination. Obviously, before this, the first introduce yourself and obtain a consent. Explain the appropriate exposure, consider the patient's general and nutritional status. I would like to call Dr. Sehrish to apply these things on patient Ahmed. Dr. Ahmed.
Assalamu alaikum.
Welcome.
I'm Dr. Sehrish, and here I'm here to check your GLD system. So I need your consent.
So, consider the patient general nutritional status. Can you please ask him what nutrition he takes, why he is here?
Please tell me your, about the diet and any change in your whatever.
No, it's not like.
Normal? What is your weight?
It's 78 kg.
And height?
It's 6 feet.
6 feet.
So here I'd like to explain a point. We need to ask about the calorie intake from the patient because according to the BMI, everyone have to take the food. Everyone have to eat the food according to the calorie intake, according to their work, according to the exercises you do or not. So according to that, we need to ask the question of body mass index, BMI. Is it normal or not? So vital signs: the body temperature, pulse rate, respiration rate, rate of breathing, blood pressure. Blood pressure is not considered as a vital sign, but is often measured along with the vital signs. So can you please check his body temperature? Is it normal? We don't have the varieties here, but you can guess it. Pulse rate, please. Normal. Respiration rate, rate of breathing. Not by auscultation. You can ask him to breathe quickly, normally. Tidal volume, residual volume, you can check it by. It's normal. Okay. So blood pressure, we don't have apparatus here. Well, I hope it's normal. Okay. So here are the peripheral exam: upper limb, face and neck, chest and legs. Mental state, including agitation, pain, discomfort, well, from the skin side, is visible signs of pigmentation or jaundice. Body, hepatitis, cachexia, posture, deformities, abnormal movements, resting tremor, agitation, supplemental aids, oxygen mask, and involvement. So, first of all, in peripheral exam, we have upper limb, but a patient, we don't have a blindfolds here, so can't check chest and legs. If you, okay. Well, so I like the research to check his mental state, including agitation. Well, he's a young patient, so we can check his pain and discomfort. If you have any. Alright.
And I want to check skin for the
Pigmentation or jaundice, any discoloration of the skin. No, okay. So, abnormal movements, resting tremor, agitation, okay, it's also normal. Oxygen mask involvement is also normal for that. So abdominal examination, we reach to it. So first of all, inspection. So you need to inspect about his abdominal, is it normal or normal? Palpation, percussion, auscultation. As always, all the vital signs are important, but he especially cautions for the signs sepsis or perforation, tachycardia, hypertension, febrile, poor prognosis if untreated. So palpation, you ready for it? You can proceed. You can.
Yes, sir.
Yeah, please, Dr. Sehrish, palpate his abdomen. Superficial, umbilical region, hypoglossal region, all of it, all of the 9 regions, you need to go for it. Please.
We start from right ear fossa, from here. Right ear patient. And we go 1 centimeter above and till the lever edge. Is there any pain or discomfort? And then we take the lever edge. Intercostal space. Now then we will check for the spleen. Superficially palpate the patient's abdomen. First we palpate right iliac fossa, and then we will go 1 centimeter above till the lower edge of the lever, and then we go in an S-shaped manner, and then we will palpate the spleen. For spleen, if we can't palpate the spleen, then we ask the patient to turn over on the right side so that we will press and then turn. We will press the left and then we will palpate the spleen here. Okay, now.
Let's proceed to another spot.
You can see.
So in peripheral exam, so we got this again, hand, distal, nails, diaphragmia, Merkel's lines, sign of hypoalbuminemia, liver disease, kilonachia, spoon, iron deficiency, clubbing, IBD, liver cirrhosis, etc. Peripheral cyanosis, liver diseases. I'd like to call Dr. Sehrish to check all these things in Dr. Ahmed. Please, as patient. First of all, hands, distal area, nails.
Can you show me the hands? We check the nails. We see colinacea or licanicia and clubbing.
Yes.
So for clubbing, you will make.
Iron deficiency, clubbing, IBD, liver cirrhosis, etc. So the next we have proximal. We got here palms, palmar erythema, alcohol overdose, palmar pallor, polyness, anemia, then tendon, xanthomata, cholesterol, Dupuytren, contracture, alcohol, exposed by alcohol, haptic flap, and haptic encephalopathy. So first of all, check the patient palms, please.
Excuse me for this. Proximal, it's all also included in the distal palms.
Okay.
There is a mistake.
Well,
Okay, show me your hands for comparison. And can you please make your front up? Here we are checking for flapping tremor. So if there are any liver chronic liver.
so we got some pictures here. It's tendons and tomata. Some signs on the palms, swelling. Yeah. So arms we have bruising, coagulopathy, liver diseases, wasting, a light sign of malnutrition, scratches, pruritus from jaundice, spider nevi, type of telangiectasia, blanches with pressure, axilla, acanthosis nigricans, dark patches in the skin folds and creases seen with the insulin resistance, diabetes mellitus is the probably cause. So I'd like to ask you can please check wasting, scratches, spider nevi, bruising in our patient, please.
Your arms. First we check bruising and I can't see any bruising.
Okay. So
If there are more than 5 spider nevi, like it may be in the pregnancy, or chronic liver disease.
that's a good one. So let's proceed to another page. So we go to face and neck. For eyes, we check scleral, icterus, and conjunctival pallor. Kaiser, Fletcher rings, Wilson's disease, xanthal samla, cholesterol, mouth, histiosis, teeth, and dental hygiene, leukoplakia, tobacco and smoking, atrophic, glossitis, angular stomatitis, iron, vitamin B or folate deficiency, ulcer, benign, ACPAS or IBD. So can you please check your patient's eyes, scleral, icterus, and conjunctivitis pallor, if you got any or no.
Can you see your it's normal and then mouth.
Halitosis.
Okay.
Halitosis.
We take them mouth for halitosis and the dental hygiene. Dental hygiene is good and other normal other
So we got some pictures for the Kaiser Fletcher rings and xanthal samla. So you know the whitish areas here. Glands, parotid enlargement, alcohol abuse, all lymph nodes, texture tendon, vertical lobe supraclavicular nodes, because this is classically the first palpable one in the metastatic stomach cancer. Chest and legs, we got chest, we check the spider neck and gyne as aforementioned. Gynecomastia, liver cirrhosis, liver or lung cancer, alcohol use disorders. Well, gynecomastia is caused by the hormone, is when the female hormone progesterone are higher than testosterone in male. We call this condition gynecomastia. So can you please check
Can you
this?
slide on? Yes, I want to get spider benefits. This is normal. There is no spider nevi. It's normal.
Alright.
Just normal.
So now we have legs. We need to check the edema, liver disease, and cirrhosis. We check if there's any swelling, which is not caused by anything. You get the Abdominal node here. And please check the abdomen is next. Of course, and the unknown. Oh yeah, abdominal exam inspection where we check the shape, surgical scars, distension, swelling, strain, asymmetrical movement, mass, organs, bruise, pull and sign, acute hand pancreatitis, greater sign, retroperitoneal, umbilicus, pointing down, classically ascites, pointing up, pregnancy or tumor, caput medusa, severe portal HT. So we got some pictures of Poland signs, great tuna sign. You can see the purplish discoloration of skin, especially on the abdomen. So palpation and percussion, all 9 regions, first soften then deepen. Think about which organs are under your hand. So is there any tenderness, goading, rigidity, lever, percus, along with MCO until hit the dull note palpate directly upwards on the right side, moment during the expiration. So gallbladder, we have in gallbladder, Murphy's sign, deep inspiration, palpate, RUO, patience, catches breath, indicates cholecystitis. Coalescence sign, non-tender but enlarged gallbladder, suggests a pancreatic cancer, typically the head. You can please check all of these quickly. All the 9 regions of the abdomen, umbilical, hypoglossal, etc. Those. First is soft, first apply the soft, and then go deeper. Is there any tenderness, goading, or rigidity? So, Dr. Sehrish checked all the 9 regions of the abdomen. It is normal. So, let's move forward. We go to Murphy's sign here. Typical is a positive in cholecystitis. It is performed by asking the patient to breathe out and then gently placing the hand below the costal margin of the right side at the mid-clavicular line, the approximate location of the gallbladder. Cholecystitis is basically the gallstones. So we need to go for it.
Now I will check for the Murphy's sign. Take a deep breath. And also while examining the abdomen, we will see the facial expression of the patient, so either discomfort or pain.
Right. So let's proceed to Courvoisier law. Yes. Okay. In the presence of jaundice and palpable gallbladder is mostly likely due to the malignant obstruction of the bile duct, based on the presumption that the patients with the gallstone have a chronically inflamed fibrous gallbladders incapable of distensions does not always hold true, etc. Emphysema plus CBD stone. So spleen pitches from RIF to left costal margin, palpate diagnostically from the right iliac fossa to the left upper quadrant, since feeling for the inframedial expansion. Kidneys. In kidneys we have development to check for the involvement of kidneys, aorta perumbilical 2 to 3 centimeter, expansile, mass AAA, shifting dullness, specific sign to help locate sites. Purpose of going from one side to the other and mark areas where dull sound is heard fluid. It can be fluid. So roll patients to the other side and wait 30 seconds, then that, because where you heard the dull sound, if it now sounds resonant, the test is positive. So because fluid will have moved away by the gravity. Bowel, we have in bowel normally sounds soft and gurgling, high-pitched thinking, obstruction, splashing, slushing, gas or fluid trapped inside the obstructed organ. Auscultation. In auscultation, we have groups listen to the aorta and rental arteries for the sign of arteriosclerosis or stenosis. So, I think that's all we have. Thank you.